medication errors are the one of the very common cause for preventable deaths worldwide. In healthcare, we are continuously prescribing a lot of medicines. Our patients are taking over-the-counter medicine. So how we can reduce medication errors? Because if we can have safe practice, if we can reduce medication errors, we can reduce a significant portion of preventable death worldwide. Hi, if you are new to this channel, welcome. My name is Dr. Hoque. I'm an associate professor of medicine and a board certified physician in the US. In this video, I will share with you a couple of safe practices that we can implement easily to reduce medication errors that will save our practice as a clinician, and also our patients, our community will be safe. So the first tip is very important. That is, always check for allergy when you are prescribing any medicine. It may sound no-brainer, okay, I need to know about allergy. At the same time, you also know that when a physician or a clinician is prescribing a medicine, sometimes we may overlook patient's allergy. In the US, due to the electronic medical record, EMR, it is many times must be easier for us because it may give the flag. Not necessarily all the time. This rate is not 100%. So that's why even if you use electronic medical record, always ask for patient about their allergy if you are prescribing any new medicine. What about if you are practicing medicine somewhere else where there is no electronic medical record? Always take time to ask patient or their family if the patient is not able to tell you if there is any significant allergic reaction to any particular drugs they remember. Even in America, the EMR may not always pick up all the allergy. For example, I had a patient few years ago. Patient came from allergic reaction of a specific medication he received at the urgent care. Surprisingly, this patient had allergic reaction 1 hour earlier due to the same medicine. However, it did not show up in the EMR of urgent care, and then he ended up in the hospital. So number one tips is always check for allergy. The second tip is end date. Whenever you are prescribing any medicine, it could be antibiotic, it could be anticoagulation, always specify about the end date. If you are prescribing through electronic medical records, through the electronic prescription, please put the end date in the EMR. If you are practicing in a clinic or seeing the patient during their hospitalization, if you know that, okay, this medicine should be like 1 week, 5 days, 7 days, whatever it is, the duration, make sure you are including the end date. Most of the time, end date is applicable for antibiotics, anticoagulation. Maybe, if the patient is taking any medicine for blood pressure, hyperlipidemia, that we can continue. So it is very important to have end date for a specific medication, particularly for anticoagulation, if you are prescribing as DBD prophylaxis after surgery, and also for antibiotic. The third tip is that reconciliation. Medicine reconciliation is one of that very sensitive situation. If it is not done right, it may do more harm rather than any benefit to our patients. And our first promise to our patient is do no harm. So how we can make sure patients are getting safe care and no harm during the reconciliation? The reconciliation can happen at multiple phases in healthcare. For example, if the patient is getting admitted to your hospital during the admission, or maybe, in the clinic, you are just seeing this patient for the first time. So what is the first encounter when you are having with the patient? Ask the patient, okay, which medicines they are taking. If the patient doesn't know, ask that family member who know about patient's health and patient's medicine. Many times, as the practicing physician in the hospital, I see the patients, maybe they are confused, not oriented, geriatric patient, they do not know all about their medicine. So that time I call the family who know. If the family doesn't know, you can take two steps. One, you can take a look at the dispense report in the electronic medical record. That will help you to understand which medicine is the patient taking, what dose is the patient refilling it regularly. Or if the patient is coming from any particular facility, for example, nursing home, rehab, you can also call them and verify the medication list. Whether you are seeing this patient in the hospital or clinic, it is very important to have thorough medicine reconciliation during the first encounter. What about during the transition of care and during the discharge? Discharges, again, is very sensitive time. We need to have very thorough, comprehensive medicine reconciliation during the discharge. Because, if there is any information that is not done correctly during the discharge reconciliation, patient may suffer. For example, I had a patient who had surgery, knee surgery. Somehow, patient did not get the DBT prophylaxis anticoagulation. And within 2 weeks, he ended up in the emergency room with huge right leg swelling, pain, tenderness, and was found to have deep venous thrombosis. So, what you can do to make sure, okay, there is no error during the medicine reconciliation during discharge, making sure you are stopping all the medicine if you want to do that. Sometimes, when patient come to hospital, we change the dose. We may, put the other medicine. So if, for example, if patient was taking two medicine for blood pressure control, now you are adding another, assess it that, okay, does this patient need to continue these three medicine, or you are stopping any particular medicine before the discharge. And also I saw that sometimes if the, for example, patient was taking beta blocker, one trade name before the admission. And during the discharge, patient got somehow another beta blocker. And it was not stopped correctly during the discharge. And patient was taking two beta blocker after the discharge and then ended up with extremely low heart rate. So rule of thumb is always have comprehensive medicine reconciliation during discharge. The fourth tip is that doesn't matter how comprehensive medicine reconciliation we are doing, allergy we are checking, nothing will work if the patient doesn't know what changes are you making, what they need to do. So the fourth tip is timely patient education. You must have to have that discussion with the patient that, okay, which medicine you are changing, which dose, or what is the rationale for that, why you are giving this medicine, what is the risk of it, and which things patient need to be vigilant about. For example, if you are prescribing an antibiotic to the patient need to know the specific side effect of those medicine. So never wait for the discharge date to educate everything to the patient all at the same time, because discharge time they are thinking about going back to home or going back to facility, they're calling their family, there are so many things on their plate. So if you are adding in a new medicine, always make sure to take few minutes to educate that patient right away. You may have a patient who is dementia. You are quite confident, okay, patient will not be able to remember. So what you can do at that moment, you can talk to that one family member who truly knows about their patient's health and manage their medicine. It is very important to educate them. And the fifth tips is that my mentor always told me that in North America, particularly, It did not happen if we did not document. So, in addition to doing thorough reconciliation, all the advices what I just mentioned, it is critically important to document. What kind of discussion you had, what was the response from the patient or patient's family about this new medicine, about this side effect. Make sure you are documenting that. And another bonus tip I would like to add here, you know, medication world is continuously changing. There are so many new medicine are coming. Sometimes, there is new side effect popping up. So it may not be realistically possible to know thoroughly about all the medicines in healthcare we practice. At the same time, as a clinician, it is very important for us to know and have clear understanding what is the indication, the risk, what could be the drug interaction patient may be having. So during that situation, make sure you are looking at the reliable sources. And what could be those sources, such as up to date, open evidence, and full disclosure. There is no financial relationship with this platform. You can use this platform, and most of the time, now they are quite easily accessible through the EMR or through the phone app for open evidence up to date. So take a look quickly if you are not certain about any medicine so that you can prevent that medication related errors. And always, our pharmacy colleagues in any hospital, you can always reach out to them, ask them, okay, what will be this, renally adjusted dose for this kidney failure patient? Maybe what will be the dose for this patient whose LFT liver function test is very high? Is this the safe medicine for them? And also the drug interaction. It is very important to a specific tell what is the major drug interaction, knowing it and informing the patient. So these are the couple of tips I believe you will find helpful to reduce medication errors. And if you have any other tips that you believe, okay, these are important to know and practice, please put it in the comments. I always make sure to read them thoroughly. And this is a community because your wisdom can also help other physicians and clinicians who are in this channel, in this community. Please like this video and subscribe to this channel because your subscription does not cost a thing. At the same time, it really helps to grow this channel a lot and empower us to bring more useful video for you. Thank you so much for joining me today. I will see you in the next video. And until then, take care and have a great of your week. Bye.